You're watching ABC4 News, celebrating 75 years.
According to the Centers for Disease Control and Prevention, suicide was the leading cause of death in the United States and the 9th leading cause in Utah in 2020.
Advocates from the American Foundation for Suicide Prevention, the largest suicide prevention organization in the U.S., meeting with lawmakers today to urge them to prioritize suicide prevention and mental health initiatives for Utah residents. ABC4 photojournalist Tracy Smith with that story.
I went from working as a psychiatric tech, hanging out with friends and families, to becoming extremely sad, withdrawing from friends and family, and staying in bed all the time.
There are many more bills related to mental health this year than ever before.
It provides startup money for assertive community treatment teams.
This is a day for people who've been affected by suicide, by mental health conditions, to come together and share their voices with our legislators.
This has been a really hard session on the LGBTQ plus community, especially our transgender community, and we need mental health services more now than ever.
On one hand, I felt relieved that there was a reason for why I was feeling like this, but on the other, I felt blamed for everything that was happening.
The stigma is a real impact to people getting mental health care across the country.
One of the big things about mental health is sometimes people don't know they need it, and on the other thing is sometimes people don't know how to get people that help.
It has to be a friend reaching out to me saying, gosh, how are you doing? I mean, we encourage folks all the time to reach out to their group and just ask folks how they're doing.
Mental health affects all of us. We all have mental health because we have a brain, right? And so we need to make sure that we understand what it looks like when our mental health is declining, that we can get help, that people are trained to help us when we do reach out. But it really takes all of us.
Representative Rosemary Lesser and I worked on this bill together. That bill says if you work in behavioral health and you need behavioral health treatment, you don't have to get treatment in your own facility.
I feel very strongly now that we have put very effective and very appreciative barriers in place in the 988 hotline and the Safe UT app.
There's always work to do. We were talking before, we get little micro improvements in things, but I think in general we're going the right direction.
House Bill 259, that is called Suicide Prevention in Correctional Facilities.
We absolutely have to do more. And that is what all of these efforts are, for prevention, but also intervention. And then if someone does die, protecting the people who are around them to keep them safe too.
Have a real conversation, meaning say something. Ask them how they're doing. Be willing to hear it. You don't have to fix it. You probably can't. But you can have a conversation that says, I see you, I care about you, and I want to help you.
Reporting from the state capitol, I'm Tracy Smith, ABC4 News.
Learn more about AFSP and join the conversation on suicide prevention by following them on social media and at their website that we have for you right there at the bottom of the screen. Also, we're going to go deeper into this conversation this week with Taryn Hyatt on Inside Utah Politics. You can find that Sunday morning at 8 a.m.